Good afternoon, everyone. My name is Rochelle Domier, and I'm a graduate student at the University of Texas at Arlington College of Nursing and Health Innovation. Today, I'll be presenting a comprehensive strategic and marketing plan for Nursing and Therapy Services of Colorado, also known as NTSOC. First, I'll provide a brief description of the organization before discussing the key components of the strategic and marketing plan. So some information about NTSOC. NTSOC was founded in 2001 as a nonprofit pediatric home health agency that was dedicated to serving children with complex medical needs. The organization provides a range of direct care services, which include certified nurses aid, private duty nursing, intermittent skilled nursing visits, and in-home support services. In addition to nursing care, NTSOC offers comprehensive home-based therapy services, which include physical, occupational, and speech therapy, which is striving to promote functional development and independence in the home setting. In addition to therapy services, the agency also operates an outpatient therapy clinic and manages a certified nurses aid training program, which supports the community workforce as well as provides medical training to relative caregivers. Let's take a closer look at what NTSOC represents. Looking at their mission and vision, NTSOC's mission is to provide patient-focused care that empowers individuals throughout all stages of life, and its vision emphasizes delivering compassionate and ethical care while working with community partners to promote inclusion and independence for all patients. This slide outlines our patient care delivery model at NTSOC. NTSOC uses a patient-centered care model for pediatric patients. We focus on a patient-centered home-based approach that involves families and care, including parent and caregiver education. Our PDN program provides one-on-one skilled nursing for complex pediatric patients, as well as NTSOC emphasizes nursing and training competency validation for high-quality care. NTSOC emphasizes collaboration across interdisciplinary care teams for coordinated care to ensure the best outcomes possible, and care is guided by evidence-based protocols to ensure safety and quality. NTSOC invests in ongoing staff education and training to maintain high standards, as well as ensuring reliable staffing, emphasis on recruitment and retention, which are key to consistent care delivery. Here's an overview of the strategic plan for NTSOC. The strategic plan focuses on expanding NTSOC's private duty nursing program for medically complex pediatric patients over a 3-year time frame. As it stands right now, NTSOC is very limited in the acuity levels due to limited training capacities. So we are unable to take several referrals that we receive due to inability to accept acuity levels. A key priority in the strategic plan is enhancing clinical education through a new simulation lab to improve nurse training and competencies. We aim to strengthen nursing skills in critical areas like ventilator management, tracheostomy care, wound care, and infusion therapy, as well as hiring a nurse recruiter that will support targeted recruitment and improve our staff retention. Marketing efforts will increase awareness of our services as well as strengthen patient referral sources. In addition, our strategic plan will include development of partnerships with hospitals, clinics, and community groups to also assist with our visibility. The wound care program and CLIA certification for infusion services will be important additions in years 2 and 3. Patient growth is projected steadily doubling each year with a goal of 48 PDN patients by the end of year 3. We will utilize our grant funding and leverage our nonprofit status to obtain financial support for our training initiatives. I will briefly discuss the overview of the strategic plan for each year of the 3-year plan. In the first quarter of year 1, we will hire at least one nurse recruiter to strengthen our staffing efforts, as I referred to earlier in the presentation. The Director of Clinical Education and the Director of Nursing will lead training initiatives by leveraging their clinical expertise in infusion and wound care to develop our early stages of our training programs. We plan to launch a simulation lab focused on ventilator management, tracheostomy care, and nasogastric tube management to enhance our nurse competencies prior to patient care delivery. Concurrently, marketing for private duty nursing will begin through collaborations with hospital case management, referral navigators, and active participation in community events to increase program visibility. In year 2, we will implement a wound care program which will include 3 nurses obtaining formal wound care certification training utilizing grant funding that was recently secured. The remaining nursing staff will be trained in the simulation lab to build competency, and all nurses will participate in supervised clinical practice in patient homes until fully competent. In year 2, we will pursue our CLIA certification to expand services to include infusion therapy and in-home lab draws. In year 2, marketing efforts will focus on community engagement, including participation in local events, college career fairs, targeted social media campaigns, with the goal to attract new staff and raise awareness of PDN services. In year 3 of the strategic plan, NTSOC will launch PDN infusion services, which we talked about includes in-home laboratory draws, central line management, and infusion therapy. Nursing staff will also receive simulation-based training, followed by home-based skills validation to ensure safe, competent infusion care, as well as marketing efforts will specifically target infusion services, aiming to establish Children's Hospital outpatient specialty clinics as our primary referral source. NTSOC's marketing plan overview. Our goal is to expand access to high acuity pediatric home care patients and strengthen our referral networks. We are targeting multiple groups, which include families of medically complex children, hospital discharge planners, and specialty clinics, as well as RNs and LPNs and nursing students for recruitment of staff. To reach them, we will conduct provider outreach, hospital presentations, participate in community events, maintain a strong social media presence, attend career fairs, and develop educational materials and brochures highlighting PDN and our specialized services like wound care and infusion therapy. Here's an overview of projected annual revenue over the course of 3 years. As you can see, there's a substantial increase each year in revenue. I will discuss a breakdown of monthly and yearly revenue in the upcoming slides. This slide reviews the projected monthly patient census and revenue for year 1. We start with 1 patient in month 1, gradually increasing by 1 patient per month. Monthly revenue grows steadily as the census increases, reaching 12 patients by month 12. The total projected revenue for year 1 is just a little over $1 million. Year 2 begins with 12 patients that have carried over from year 1. The census grows steadily by 1 patient per month, reaching 24 patients by month 24. Monthly revenue continues to increase as the patient census grows. The total projected revenue for year 2 total across all 12 months is $2,898,464. Year 3 starts with 24 patients from year 2. Growth accelerates to 2 new patients per month, reaching 48 patients by month 36. Monthly revenue increases as patient number grows, reflecting higher service utilization of high acuity PDN services. The goal of projected revenue for year 3, ending with 48 patients, is $5,796,927. The projected growth is conservative over the 3-year plan due to the potential challenges of obtaining PDN prior authorization request approval through the state vendor of Acentra, while accounting for unforeseen discharges to ensure we have a net gain of at least 1 to 2 patients per month. NTSOC proposal summary. This proposal focuses on investing in a simulation lab and enhanced training to expand the acuity of PDN patients we can safely serve. Expanding patient acuity addresses the growing health needs of the pediatric community, and these initiatives support sustainable revenue growth by increasing service capacity, as we often experience challenges related to Medicaid reimbursement. Investment in training strengthens clinical quality, workforce competence, and overall organizational capacity, as well as marketing efforts that will focus on community outreach, digital marketing, and social media campaigns to increase program visibility and attract new patients and staff. The plan also expands community partnerships and referral sources, enhancing engagement with hospitals, clinics, and local organizations. The marketing plan proposal summary focuses on community outreach to strengthen local awareness of NTSOC services, as well as I stated, digital marketing campaigns, which will be used to reach a larger audience and inform patients and caregivers about our new services. Social media engagement, such as Facebook, TikTok, Instagram, will target both prospective patients and qualified staff, helping to attract and retain skilled nursing staff. Overall, the proposal summary is to increase program visibility, build community partners, and increase referrals and expand our services of high acuity private duty nursing patients. Questions?